Welcome to another episode on Puberty Focus, understanding menstrual health and common issues. In this episode, we'll dive into 3 important menstrual health topics that impact many people during puberty and beyond: amenorrhea, dysmenorrhea, and premenstrual syndrome, PMS. These conditions may seem complex, but understanding what they are and how to manage them can make a big difference in everyday life. We'll discuss why amenorrhea, or the absence of menstruation, can happen, explore the causes and relief for painful cramps in dysmenorrhea, and break down the physical and emotional symptoms of PMS. This episode will equip you with valuable information to better understand and navigate these menstrual health challenges. Let's get started. Amenorrhea. Amenorrhea is the absence of menstruation, often defined as missing one or more menstrual periods. There are 2 types. Primary amenorrhea refers to the absence of menstruation in someone who has not had a period by age 15. The most common causes of primary amenorrhea relate to hormone levels, although anatomical problems also can cause amenorrhea. Secondary amenorrhea refers to the absence of 3 or more periods in a row by someone who has had periods in the past. Pregnancy is the most common cause of secondary amenorrhea, although problems with hormones also can cause secondary amenorrhea. Treatment of amenorrhea depends on the underlying cause. Causes. The main causes of primary amenorrhea include family history, genetics, and lifestyle. Women with the following factors are more at risk. 1. A family history of amenorrhea or early menopause. 2. A genetic or chromosomal defect. 2. These can affect your ovary function and menstrual cycle. 2. Turner syndrome is one example. 3. Severely overweight or underweight. 4. An eating disorder. 5. An extreme exercise pattern. 6. A poor diet. 7. Stress. 8. Pregnancy, breastfeeding, and menopause can cause secondary amenorrhea. 8. Other possible causes include 9. Some birth controls, such as pills, injections, or intrauterine devices. 9. These can affect your menstrual cycle during and after use. 10. Some medicines for depression and blood. 11. Chemotherapy and radiation treatment. 12. Polycystic ovary syndrome, PCOS. 13. Fragile X syndrome, caused by the FMR1 gene, or Fragile X-associated primary ovarian insufficiency, FXPOI. 14. Problems with your thyroid or pituitary gland. 15. Hypothalamic disease. 16. Uterine scar tissue. Treatment. Treatment options for amenorrhea vary based on the cause. You may need to make lifestyle changes, such as diet, activity, and stress. Certain hormonal medicines and birth control pills can help trigger a period. Others can help trigger ovulation, such as for PCOS. Hormone therapy may be used to balance out your hormones. Surgery is rare, but may be needed in some cases, such as 1. To correct genetic or chromosomal defects. 2. To remove a pituitary, brain, tumor. 3. To remove uterine scar tissue. Dysmenorrhea. Dysmenorrhea is the medical term for painful menstrual periods which are caused by uterine contractions. There are 2 types of dysmenorrhea, primary and secondary. Primary dysmenorrhea is the name for common menstrual cramps that come back over and over again, recurrent, and aren't due to other diseases. Pain usually begins 1 or 2 days before you get your period or when bleeding actually starts. You may feel pain ranging from mild to severe in the lower abdomen, back or thighs. Pain can typically last 12 to 72 hours, and you might have other symptoms, such as nausea and vomiting, fatigue, and even diarrhea. Common menstrual cramps may become less painful as you get older and may stop entirely if you have a baby. If you have painful periods because of a disorder or an infection in your female reproductive organs, it is called secondary dysmenorrhea. Pain from secondary dysmenorrhea usually begins earlier in the menstrual cycle and lasts longer than common menstrual cramps. You usually don't have nausea, vomiting, fatigue or diarrhea. Causes. Menstrual cramps happen when a chemical called prostaglandin makes the uterus contract, tighten up. The uterus, the muscular organ where a fetus grows, contracts throughout your menstrual cycle. During menstruation, the uterus contracts more strongly. If the uterus contracts too strongly, it can press against nearby blood vessels, cutting off the supply of oxygen to muscle tissue. You feel pain when part of the muscle briefly loses its supply of oxygen. Menstrual pain from secondary dysmenorrhea is a result of problems with the reproductive organs. Conditions that can cause cramping include 1. Endometriosis, a condition in which the tissue lining the uterus, the endometrium, is found outside of the uterus. 1. Because these pieces of tissue bleed during your period, they can cause swelling, scarring and pain. 2. Adenomyosis, a condition where the lining of the uterus grows into the muscle of the uterus. 2. This condition can cause the uterus to get much bigger than it should be, along with abnormal bleeding and pain. 3. Pelvic inflammatory disease, PID, an infection caused by bacteria that starts in the uterus and can spread to other reproductive organs. 3. PID can cause pain in the stomach or pain during sex. 4. Cervical stenosis, narrowing of the cervix, or the opening to the uterus. 5. Fibroids, benign tumors, growths on the inside, outside or in the walls of the uterus. Management and treatment. To relieve mild menstrual cramps. 1. For the best relief, take ibuprofen as soon as bleeding or cramping starts. 1. Ibuprofen belongs to a class of drugs called non-steroidal anti-inflammatory drugs, NSAIDs. 1. They reduce the output of prostaglandins. 1. If you can't take NSAIDs, you can take another pain reliever like acetaminophen. 2. Place a heating pad or hot water bottle on your lower back or abdomen. 3. Rest when needed. 4. Avoid foods that contain caffeine. 5. Avoid smoking and drinking. 5. Alcohol. 6. Massage your lower back and abdomen. 7. Women who exercise regularly often have less menstrual pain. 7. To help prevent cramps, make exercise a part of your weekly routine. Premenstrual syndrome. 1. Premenstrual syndrome, PMS, refers to changes in mood and emotions, physical health, and behavior that 1. Develop between ovulation and the start of your period, roughly the 2 weeks before your period. 2. Last until a few days after your period begins. 3. Show up consistently each month. Symptoms of premenstrual syndrome: emotional and behavioral symptoms. 1. PMS-related changes in your mood, emotions, and behavior might include 2. Anxiety, restlessness, or feeling on edge. 3. Unusual anger and irritability. Changes in appetite, including increased food cravings, especially for sweets. Physical symptoms. With PMS, you'll likely also notice some physical symptoms, such as 1. Abdominal bloating. Cramping. 1. Sore and swollen breasts. 2. Acne. 3. Constipation. 4. Diarrhea. 5. Headaches. 6. Back and muscle pain. Unusual sensitivity to light or sound. 1. Unusual clumsiness. Causes of premenstrual syndrome. Scientific research hasn't led to a conclusive cause of PMS, or an explanation for why some people experience it more severely than others. That said, researchers have suggested a few different theories. 1. Cyclical changes in hormones. Many experts believe PMS happens in response to changing levels of the hormones estrogen and progesterone. These hormones naturally fluctuate throughout your menstrual cycle. During the luteal phase, which follows ovulation, hormones reach a peak and then decline rapidly, which may lead to anxiety, irritability, and other changes in mood. 1. Chemical changes in the brain. The neurotransmitters serotonin and norepinephrine have several important functions in the body, including helping regulate mood, emotions, and behavior. These chemical messengers may also factor into symptoms of PMS. For example, a drop in estrogen may prompt the release of norepinephrine, which leads to declining production of dopamine, acetylcholine, and serotonin. These changes can trigger sleep problems and lead to a low or depressed mood. Experts have yet to arrive at a conclusive explanation for the link between mental health symptoms and menstruation-related mood changes. But many believe it relates to the chemical changes in the brain discussed above. Lifestyle factors. Certain habits might affect the severity of your PMS symptoms. Potential lifestyle factors that could worsen PMS symptoms include 1. Smoking. 2. Eating a lot of foods high in fat, sugar, and salt. 3. A lack of regular physical activity. 4. A lack of quality sleep. Management of PMS. While there's no cure for PMS, you can take steps to ease your symptoms. To get relief from mild or moderate symptoms, it may help to give the following strategies a try. 1. Drink plenty of fluids to ease abdominal bloating. 1. This includes herbal teas, like red raspberry leaf or chamomile, which may ease cramping. 2. Eat a balanced diet that includes plenty of fruits, vegetables, and whole grains. 3. Consider cutting back on sugar, salt, caffeine, and alcohol, especially if you're particularly sensitive to their effects. 4. Aim to get 7 to 9 hours of sleep each night to help relieve fatigue and improve overall well-being. 5. Try to get at least half an hour of physical activity each day, if you're able. 5. Exercise can not only help relieve bloating and cramping, but it can also help ease anxiety and depression symptoms. Set aside time each day for self-care, which might include exercise, relaxation, time to yourself for hobbies, or time for social interaction. 1. Over-the-counter medications. Premenstrual dysphoric disorder. Premenstrual dysphoric disorder, PMDD, is a more serious form of premenstrual syndrome, PMS. PMS causes bloating, headaches and breast tenderness a week or two before your period. With PMDD, you might have PMS symptoms along with extreme irritability, anxiety or depression. These symptoms improve within a few days after your period starts, but they can be severe enough to interfere with your life. Causes. Experts don't know why some women get PMDD. Decreasing levels of estrogen and progesterone hormones after ovulation and before menstruation may trigger symptoms. Serotonin, a brain chemical that regulates mood, hunger and sleep, may also play a role. Serotonin levels, like hormone levels, change throughout your menstrual cycle. PMDD symptoms appear a week or two before menstruation and go away within a few days after your period starts. In addition to PMS symptoms, you may have anger or irritability, anxiety and panic attacks, depression and suicidal thoughts, difficulty concentrating, fatigue and low energy, food cravings or binge eating, headaches, insomnia, mood swings. Diagnosis and tests. Your healthcare provider will take a medical history and evaluate your symptoms. You may need to track your symptoms through 1 or 2 menstrual cycles. To diagnose PMDD, your provider will look for 5 or more PMDD symptoms, including one mood-related symptom. Your provider will rule out or diagnose other conditions such as anxiety, depression or reproductive disorders. Management and treatment. Your healthcare provider may recommend one or more of these treatments to help manage PMDD. 1. Antidepressants to help manage your brain's serotonin levels. 2. Dietary changes, such as cutting back on salty, fatty or sugary foods and caffeine. 3. Hormonal birth control that has drospirenone and ethinyl estradiol. 4. Over-the-counter pain medicines to ease cramps, dysmenorrhea, headaches, breast tenderness and other physical symptoms. 5. Regular exercise to improve mood. 6. Stress management tools, such as deep breathing exercises and meditation.